There has always been a guiding principle in medicine. First, do no harm. This prevents a doctor from placing money above a patient. Gender dysphoria is a psychological condition where a person feels there is a difference between their experienced gender and their biological gender. Dr. Johanna Olson Kennedy, leader in gender transitioning at the Children's Hospital, Los Angeles, says, "First, do no harm is really subjective. Historically, doctors are given the purview of deciding what is going to be harmful and what isn't, and that, in the world of gender, is really problematic." Under this new trend, a child's feelings are placed above a doctor's decision. Regarding sex change surgery and hormonal therapy, new authoritative studies show this new trend is very dangerous. The June 2017 American College of Pediatricians and the Fall 2016 Mayer Report. Gender dysphoria resolves in a vast majority of childhood cases. A child's feelings are unreliable and should not determine life-altering procedures such as surgery and hormone therapy. The Mayer Report reviewed more than 500 scientific articles of clinical research concerning gender identity. It concluded, "We are disturbed and alarmed by the severity and irreversibility. Some interventions employed for children, they are increasingly receiving hormone treatments or surgical modifications at a young age. But the majority of children who identify as a gender that does not conform to their biological sex will no longer do so by the time they reach adulthood." The American College of Pediatricians add the new treatment involved pubertal suppression with gonadotropin-releasing hormone agonist followed by the use of cross-sex hormones, a combination that results in sterility of minors. Studies show these surgeries do not cure psychological conditions. Urologist Miroslav Jordavid, specialist in gender reassignment, has seen an increase in reversal surgeries. If an adult cannot make such decisions, a child's feelings should certainly not be a deciding factor in such life-altering decisions. The American College of Pediatricians states, "Given the cognitive and experiential immaturity of the child and adolescent, this policy of allowing the child to decide surgery based on feelings is highly problematic and unethical." Secondly, a child should not be making decisions about life-altering surgery when so much money is at stake for the big pharmaceutical industry and the cosmetic surgery industry, trillion-dollar industries. Cost over time can be hundreds of thousands of dollars. Finally, long-term risks are unknown. Rob Garofalo, director of Lurie Children's Hospital's Gender and Sex Development Program, admits there are so many unanswered questions around long-term consequences. The stakes are super high. The unanswered questions that really trouble me can only be answered with long-term follow-up studies. In conclusion, while medical schools are not required to abide by the Hippocratic Oath, first do no harm, is a guiding principle of the medical profession. Children must be protected from deciding life-altering surgeries, with so much at stake in terms of physical health and safety, corporate greed, and considering the unknown long-term consequences. First, do no harm.